I'm renewing the opioid disaster declaration. I guess this is the fourth renewal, so this will be the fifth disaster declaration in order to help us continue the fight against the opioid epidemic. We're doing a lot of great things. This helps us work together. 16 different agencies coming together at our command center, and I'll continue to do that. So we need to keep doing this. A disaster declaration allows us to do things that we can't ordinarily do. So I said earlier, 16 different agencies are working together, sharing information, sharing ideas. That doesn't happen absent this kind of a declaration. So we're really doing a lot of things together, going all around the state, and the disaster declaration really allows this to happen. I'm using this mechanism of a disaster declaration because it's all I have. It's a blunt instrument. I wish we had, the Department of Health had the ability to declare a public health emergency, which is essentially what this is, and it would focus laser-like on just addressing this. I'm using this to do that, to focus laser-like. But a public health emergency would just explicitly say, this is what you're focused on. And it passed the Senate unanimously, and it's, working its way around the House, and I'm hoping that happens soon. But in the meantime, this is what I'm doing. So I think it's a great question. How effective has this disaster declaration been? Because we need to fight. This is a terrible scourge, an epidemic. But since we've started fighting this in a bipartisan way, and the disaster declaration has helped over this past year, let me give you some statistics. Our doctor shopping, and we define that as people who go to 5 different physicians over a 3-month period for the same opioid. That's virtually gone to zero. That's not happening anymore. That was a problem. Prescription of opioids over the last 2 years has gone down 24%. We have saved almost 20,000 lives with naloxone, and that's just the first responders. We don't know how many private people have administered naloxone to loved ones just to bring them back. But we know there are at least 20,000 who have come back to life. And first responders who use naloxone to bring someone back to life, 92% of them go to an emergency room and start getting treatment for their problem. This is a chronic disease, and we need to do everything we can to treat this disease. There is no reason for anybody dying, and we have thousands of people dying in Pennsylvania. We've got to stop it.